So Poba asked me to come in and allowed me to reminisce a little bit about my history in interventional cardiology for congenital heart disease, and to talk a little bit about how balloons have been a major factor in the development of what is now known as structural heart disease. So when we look at balloons in general, how are they used in the cardiac and great vessel therapies? They have a couple of major activities. You can use a balloon to measure something. You can measure a hole in the heart, for example. You can use the balloon to occlude flow between one place and another. And again, that's, for example, in cardiovascular, but that's also what's done in airway disease, where you might put a balloon to try to occlude airflow between one structure and another. So use them for sizing, and you can use them for occlusion. Also, you can use balloons as a surgical instrument. Things like creating a plane of dissection with a balloon that gets inflated and moves the tissues out of the way. You can use the balloon to retract tissues away from an area that you're trying to work in as a surgeon, or under an endoscope, for example. So it can be used as a surgical instrument. They're used as delivery devices. So for many of the intracardiac devices and coronary and other great vessels, you can use them to deliver stents, use them to deliver valves, use them to deliver devices. They are also used as ablation devices for cryo-ablation in the heart. You can use cryo or RF energy that can be transmitted through the balloon wall to ablate a tissue that's they're lying adjacent to. Also, we see a lot of activity these days on using balloons to secure things in place, like secure the tip of a catheter or a delivery system in place so that it doesn't move during the normal procedure. So balloons are used as a component in a technique, or a component in a procedure, or a device to hold it in place. So those are kind of the 5 or 6 ways that balloons are generally adopted to use in a technique.